how is that person supposed to go into a job interview, and they help people, get established, get stabilized, and then they deal with the employment component. And it's the same with us. We try to stabilize the individual and understand what things could be affecting them and understand where they're coming from. And then once we help address the whole person, we can help with their health issues and then establish that kind of rapport. And by removing the barriers, we can help them feel comfortable and stabilized. And then those other things will kind of all come together. But we can't just see somebody who's homeless coming in, who's diabetic, and I'll just leave that. Who's diabetic and has their insulin in their car, and just say, well, here's a new prescription. Well, how can we get you into housing? How can we figure out the whole situation to get you stabilized, to get you healthy, and then you can be a better citizen of the community. And our approach is to deal with the whole person and all these other things that are affecting them, and then we understand that once that happens, they can be more self-sufficient and contribute to the neighborhood well-being more effectively than just saying, come to a doctor's visit and here's a prescription. Like, that's not going to help. And so I've been passionate about connecting with other community partners that have that same vision when it comes to us, healthcare, with Southeast Works, when it comes to employment. They have embedded services, like we have embedded services. And we want to be a part of that conversation and connecting those dots, because there's a lot of organizations that are doing street medicine or street behavioral health counseling or crime prevention to rehab to housing. But there's all these little pieces, but they're not really coordinating very well. And for me, it's really important to get connected with all those organizations to see how we can better communicate across from nonprofits to for-profit. We're a nonprofit organization, or from government entities to private entities. And there's a lot of people who are passionate. There's not a whole lot of coordinating. And so what's really driving me is helping bridge those gaps between people that are doing really good work and helping us sharing information and coordinating our efforts more effectively. As a private person, I think there really needs to be some kind of coordinating council on homelessness. There's already similar models that have been created around domestic violence for individuals that go across county lines to help in the whole state. But there isn't that kind of collaboration and coordination with the homelessness problem on the streets. There's a lot of good organizations that are trying to piece together services to try to get people not just housed, but to be off of drugs, or to get their IDs, or to get clothing on their back so they can go to an interview, or transportation to the pharmacy so they can get their drugs or get access to the medications they need to feel stabilized. And so that's what we're about, and that's what we're passionate about. We're expanding to that lot across the street right now, and hopefully we'll be able to offer a pharmacy there, as well as dental services. So if somebody was just to walk in off the streets and they had no insurance, no food, maybe even a non-citizen, and maybe is curious about utility assistance, when they come in, they're not going to be turned away. We're going to see everybody that comes through the door. We have patient benefit coordinators that will see if somebody is able to sign up for OHP, get them on some kind of insurance coverage. But if they're not, we have our own sliding scale that we offer people. So, if you don't qualify for anything for whatever reason, you can still have a reduced rate. And that is all paid for from us. We might bill somebody, but we're never going to turn them away. We're never going to send them to collections. We're never going to say you can't make another appointment because you haven't paid your last bill. And we are just trying to remove those barriers for people to feel stable, to feel safe, feel connected. And we're really passionate about connecting people with resources because they're out there, but people don't know how to navigate. There's a lot of really good work happening, but they may not feel safe asking or know where to start. Like, 211's amazing, but just as a worker, I spent days just filtering through and sorting through their website and trying to see what would be appropriate, like if I'm a Hispanic senior citizen, or if I'm a victim of domestic violence and I also am addicted to drugs, like, where do I go, where do I start? And so we understand not only that people have a hard time navigating, but also culturally, maybe they're not familiar with the healthcare system. And so in-house, we have just our employees speak English, Spanish, Russian, Cantonese, Mandarin, Vietnamese, and that's just our people there. We're really good about using interpreter services. We have interpreters coming in and out all day long, as well as over the phone. So really any kind of community we're familiar with or able to at least have interpreters come in. So we're really diverse, we're really mission driven. Our doctors there have cubicle space that's probably this big. That's no bigger than the nurse. That's no bigger than the medical assistant. And we all have these little pods where we work on patients, and we really care about the family and the individual and that network and keeping it stabilized. All of our doctors are OB certified, so we do go to the hospitals to deliver babies as well. Yeah, go ahead.
We run into gals that are on the street, and they want a service like a shelter or whatever. It's during the day. There's no place we can send them.
Yeah.
Can we send them to you?
You can send them to us so we can start off that process.
Okay.
So I'd say for that person, right? Excuse me, come in, let's get you in as a patient. Let's see where you're at, first off. And then second, we figure out what.
You're gonna get a lot more patients.
Yeah, well,
Yeah.
The more people we get, the happier I am. And also,
You have to get someone who's out.
yeah,
There you go.
exactly.
There you go.
Well, that's what I figure. Coming to meetings like this, meeting other community-focused people, is like, if I tell you, you can communicate to 10 other people.
It'll be on our page.
Yeah, exactly. But, so for that individual, we'll see, okay, so you're a woman who's interested in housing. Are there other social determinants that are affecting your situation? And then we'll go through our list of resources and connections we have to see, okay, this would be a good fit. Like, even today, I met an organization that is faith-based. So maybe that person's a Christian. That they have beds open right now for people who want to go to rehab.
Right.
And it's a 10-month housed facility that is zero cost for the individual.
Cool.
So I know about it because
Where is that?
the name of the organization, I don't know. I have their card. I just met them today though. But we have those connections and we're establishing. It's like Portland.
Family Solutions?
No, it's Portland Bible College
Oh, I'll find
Rehab
I'll know
or
by
something.
99.
I don't know offhand, yeah. But we would ask, and to see if there's some kind of specific, because in general, housing, it's bad for everybody.
Yeah.
But there are some culturally specific or women specific or women's of domestic violence specific programs. So we need to get you in, sit down and talk to you. And then if we can't get you into housing right away, which is usually the case, we'll figure out what other things are happening to at least help you feel stabilized in the moment. And then we keep in contact and try to build people out of the situation they're in for the best as we can.
What are your hours?
So that's another thing that's great about our place is Monday through Friday, we're open from 7:30 a.m. to 7 p.m. So, it's a little bit beyond our normal primary care providers' office hours. And we're also open on Saturdays from 7:30 to 5 p.m. So there's extra availability. And also we rotate with our primary care providers. So on Mondays and Fridays, we have a lot of same-day appointments open. And that's just a new project that we're implementing to see how it works, just to provide more open spaces for people that come in. But also for kids, anybody under 19, really, we make it as easy as possible to come in. From their first visit, they're going to meet their primary care provider. If they've been late, did no-call, no-shows for 10 of their appointments, if they come in on the 11th, we're going to see them right away. We're going to let them make appointments. So we're really passionate about the kid population, but also for me, I'm trying to meet other populations that are maybe underserved, like people who are re-entering from incarceration. There's very little resources out there, and there's not, for the ones that are out there, they're not really communicating very well, and that's really my passion, is trying to get all those little pieces threaded together really well. So that's kind of where I'm going, but as a clinic, we're really focusing on kids and families, because we want to see the whole family, and it's easier for the primary care provider to understand what could be affecting the kid if we know that the dad has anxiety, or we know that the mom, has an addiction issue. Like, if we don't know all those things, how can we serve the kid as well? So our director is really passionate about serving children, serving families. Yeah.
You need to run a skeleton crew from like 7:30 until 6 o'clock in the morning, because I tell you what, the streets come alive at night.
Yeah.
They sleep all day long.
Streets come alive. Yeah. Well, another great service is that during our normal operating hours, when you call our number, our main number, it's a call center, and we have a nurse who does triage over the phone. That's not going to get billed extra. But if you call our phone number after hours, we have somebody on call to help triage your situation over the phone for you. So we can figure out if that's an issue where you maybe need to go to the ER right away, or you just come in the next morning. And so there's always somebody available to triage your symptoms. But you're right, like serving outside of traditional, hours, that's what we want to get into. There's going to be an Asian Health and Services Center.
Foster? Yeah.
And so we're going to be embedded there when it opens.
Oh, okay.
So we'll be on the first
You
floor.
mean you'll keep your place here, but you'll also have?
Exactly. So right now we're hiring for that.
That's like
facility.
on 89th or 87th or something, Foster.
I don't know the exact
That new
address.
building they're just
Yeah, the
putting
new
up?
building,
that's
the Asian
the-
Health Center.
The Asian Health
Yeah.
Services
All right.
Center. Yeah, and that's due to open around the end of August. I was just asking my director today if I had any kind of marketing materials to bring to y'all, but they don't have them printed up because the exact date isn't, totally set in stone. But also one of my connections with the director at Southeast Works, she is on the planning committee for the new shelter that's getting put in on Foster and 61st, and she invited us to be a part of the conversation because her vision as being part of the council developing it is to have integrated services. So it's not just a bed for you to stay while you're not doing drugs and then you leave and do drugs, but it's a place where you can stay and also find the place that will connect you to rehab, and also find the place that will help you put clothes on your back, and also find a place to help you feel stable with your food insecurity, and also find a place like us that will do some kind of medical services, or find the person who will connect you with clothing, to just put clean clothes on your back so you can go to that job interview, or if you need an ID, or if you don't know how to pay for it, to find your own social security card, and integrating all those services there, so you're not just putting a bed out for somebody to crash while they're not, doing other things on the street, but also a place where you can connect to services in a real way, and not just get a pamphlet that's on a wall, or like a piece of paper with a phone number. And so we got invited to it, and so based off of my outreach work, and it's my job to connect the dots, so hopefully my director, which I pitched the idea, is connecting with that director who is on those planning committees, so we can provide more integrated services instead of just like, here's some food, move on, or here's a bed, move on, but to try to support the whole person. Yeah.
Great.
Is there any other questions out there now? Anything? Okay.
Great.
Yeah, so I have cards, I do have pamphlets, specifically pamphlets on our behavioral health consultant services. These are in English and Spanish.
If this group ever wanted to tour, I've been on a tour,
Yeah,
could they?
of course, I would love that, and actually I've been doing that with some community partners, so the phone number's here, you can just call and ask for the outreach worker. I do have cards where I wrote down my email address for whatever reason they didn't include it on
Are
it.
you the only outreach worker?
I am the only outreach worker, so you can ask for that outreach worker. I'd gladly give you a tour of our facility, see what we do. If you want to do small groups too, I'm more than happy to do that. Also just for like people who don't know the healthcare system or what it's like to visit a doctor. I'm personally developing a program at the clinic to just introduce people to what it's like to go to a doctor, primary care provider, advocating for yourself, advocating for what you need and communicating that well in that kind of environment. And so I'm working on a program to do that, small classes for teens or adults that, you know, are trying to stabilize and trying to be contributing members to, you know, wherever they're living. So that's something that I'm working on. But as individuals, you're more than welcome. Anybody who wants to, just give me a call, ask for the outreach worker, or send me a direct email. And you have my email
I have,
address
yeah.
now, so feel free to pass that along.
Okay.
We'll be happy with that. Feel welcome. Yeah.
Thank you.
Yeah, you're very welcome. Thank
Do our officers have anything?
Yeah, do you guys have any?
I don't want to take up any more of your time.
Oh,
But you guys will be at the
You've
steering
taken
committee
up
next
so
week.
much.
Thank you for your service.
I would just say, work real hard on those garbage bag ideas. Pass them out, and hey, fill them up, bring them in, and we'll give you a couple bucks for them, $5 or whatever. These druggies have no problem going through people's garbage and scattering it all